Okay, great. Thank you for that introduction. Hi, everyone. It's great to be here with you today. I am going to talk today about an ongoing project we have exploring COVID-19 information exposure and its impacts in racial and ethnic minority groups. Okay, so first I want to acknowledge that this is a very interdisciplinary project. We have an interdisciplinary team spanning psychology, design, epidemiology, human-computer interaction, engineering, and this is our team, and I particularly want to acknowledge Anne Suhaimi, a doctoral student at Northeastern, who was instrumental in leading the analysis that I will be talking about today. So at this point, it has been well established that COVID-19 is disproportionately impacting Black, Hispanic, and low-income individuals in the United States. So Black and Hispanic children and adults are much more likely to be infected by COVID-19. We also see that they are more likely to be hospitalized as a result of COVID-19. And they are also much more likely to die from COVID-19 than white adults in the United States. And these are striking statistics that necessitate research investigating what might be done to help counter and reduce these disparities in COVID-19 morbidity and mortality. So Blacks and Hispanics are also much more likely to experience negative financial impacts of COVID-19, such as losing a job. In addition, low socioeconomic status households are more vulnerable to negative social impacts of COVID-19, such as unemployment. So public health researchers have attributed these disparities to a variety of social determinants of health that have long created inequitable health outcomes. For example, racial and ethnic minorities are less likely to have jobs that allow them to work from home, more likely to be of lower income, due in large part to structural and historical injustices that have created barriers to the attainment of wealth, high-paying jobs, and thus higher incomes. They are also more likely to be exposed to a myriad of social and physical environmental factors that predispose racial and ethnic minority groups to higher rates of the very comorbidities that are associated with COVID-19 complications, such as obesity and diabetes. So in our work, we have chosen to examine exposure to COVID-19 information as one important variable amongst many that is important to investigate when trying to understand the patterns of COVID-19 morbidity and mortality and how to improve the well-being, including the mental well-being of these populations most vulnerable to poor health amidst the pandemic. So we know that information seeking is a crucial activity during crises. It has been linked with positive well-being. For example, increased information exposure can help people to make sense of a pandemic and reduce their uncertainty, help inform them of the risks and how to prevent infection and spread of the disease, and enable access to resources that can help mitigate the negative financial, social, physical, and mental consequences of living through a pandemic. It can also increase individuals' sense of autonomy and control. There are also potential drawbacks to getting information during a crisis. This information can cause increases in stress, anxiety, depression, worry, and of course, there are also concerns around misinformation. So given the important role that information seeking plays in mental and physical well-being during times of crises, my collaborators and I are conducting an ongoing project investigating COVID-19 information, particularly exposure to it, what kinds of information are people getting, their attitudes towards this information, and then its impact on and association with psychological and emotional well-being. So we're interested in negative emotions that arise, positive emotions, and also positive reframing that individuals may be engaging in, or basically, thinking about the positive things coming out of the pandemic. And we're specifically doing this work in the context of vulnerable populations, namely low-income populations, Black and Hispanic and Latino adults. So our method, we have been conducting a longitudinal survey since July. This is an 8-wave survey. We just launched our final wave of this round this week. And today I'm going to talk just about that first wave of the survey, or analysis of that data. And this project, we launched the survey in 2 states, Georgia and Massachusetts. Conveniently, those are the states that the researchers come from, but also these states allow us to explore over time respondents' experiences, exposure to information, thoughts, perspectives in states where we've seen the pandemic play out in different ways. For example, we've seen different trends in terms of the incidence of cases there in these 2 states. So we have examined the information that people are exposed to in many different categories. So I've shown them here, and these are the different types of information that we specifically have been exploring, you know, how much people are getting this information and its association with various outcomes. And so today I'm going to speak about information exposure. And when I say that, I will mean how frequently respondents reported getting information about this type of information, from never to every day. So this is an overview of our sample. You can see that most of our respondents were 18 to 54. We also had a larger response rate from female individuals. So most of our sample is female, but we do have 34% male. And we have roughly almost a 50-50 split between Massachusetts and Georgia. We have just over half of our sample is white, and the remainder Black, Hispanic. We did have a few Asian respondents, but too little to do this analysis. So I'll be reporting on our respondents who identified in these 3 categories. And our focus in this project is on low and middle income households, given the increased vulnerability of low income adults to COVID-19. And thus all of our respondents had a household income, yearly income of less than $100,000 a year. And we created an adjusted household income rate using standards from the US federal government. So we classified those households that had 185% or lower of the federal poverty level as low income, and the remainder is middle income. I will point out that our respondents were not equally distributed in these low and middle income categories. We did have more Black and Black respondents in our low income category than white respondents. The reverse was true for our middle income category. Okay, so today I'll briefly overview several findings that shed light into the racial and ethnic differences in our data in terms of COVID-19 information exposure, attitudes, and impact, as well as how increased information exposure was correlated with various outcomes. So we started by examining the kinds of information that participants were getting about COVID-19. First, we looked at the websites people were accessing to gain COVID information. Black respondents used health-related and news websites and search engines significantly less than white respondents. They were also significantly more likely to say that they did not use websites to gain COVID information than our white adult respondents. In terms of social media, Facebook was the most used across respondents, with similar frequency across racial and ethnic groups. In addition, Hispanic and Black respondents use Instagram to gain COVID information significantly more than white Americans, and Black respondents use YouTube for information gathering significantly more than white respondents. Now, these trends are in line with prior work showing social media usage trends generally. However, the gaps between white and Black respondents for Instagram and YouTube are larger than have been previously reported. There were no significant differences in the information that respondents received about COVID-19 prevention, testing, incidence, and death. We do see that overall people were less likely to get information about testing and recovery than COVID-19 prevention and incidence and death. We also examined how much information people were getting about supportive services, such as housing and utility services amidst COVID. These resources are important for helping people cope with issues such as financial loss and mental health challenges during a pandemic. Overall, this information was obtained less frequently than that of information about COVID prevention, testing, incidence, and death that I presented on the last slide. In addition, we see large differences across racial lines in terms of exposure to this information. Black and Hispanics were significantly more likely to have gotten information about food assistance, educational support, transportation services, and housing services. Black respondents were also significantly more likely to have gotten information about coping with stress and mental health. We also see that amongst our Black and Hispanic respondents, lower income adults were more likely to get this information than middle income. However, amongst white respondents, middle income adults were slightly more likely to get this information. The fact that we did not see significant differences in the information respondents were getting around COVID prevention, cases, and deaths may be explained by the fact that we saw no statistical differences in the level of concern people had about the health of themselves, their family, and their communities. People were generally equally concerned and thus may have been seeking prevention and disease information in roughly the same manner. However, we did see that finances were a significantly higher concern for Blacks and whites, which may help to explain racial differences in gathering information around supportive social services amidst COVID. Interestingly, these concerns varied across low and middle income respondents within each racial and ethnic group. For example, amongst low-income respondents, Black and Hispanic adults were more likely to report concerns about finances and employment than their white low-income counterparts. This pattern was flipped when we looked at middle-income adults. The white respondents were more likely to have these concerns than their Black and Hispanic counterparts. We see the same pattern when we look at the health concerns as well. Low-income adults of color were more likely to have health concerns than their low-income white counterparts. And again, this pattern was flipped when looking at middle-income respondents. So we also examined how much people trusted the information they gathered from various COVID-19 sources. Now keep in mind, we asked participants to report who they got COVID information from, and for those sources, their level of trust. So we found that overall, when people got COVID information from personal and local connections such as friends, coworkers, they trusted that information to roughly the same degree across race and ethnicity. We did, however, find that there was a significant difference when it comes to getting information from family members. Black adults were significantly more likely to trust that information than Hispanics. We found overall higher levels of trust and information from some institutions and officials than for the personal and local connections described in the previous slide. So specifically, Dr. Fauci, the CDC, and international agencies such as the World Health Organization. However, our Black respondents were significantly less likely to trust information that they gathered from President Trump than white respondents. Okay, now, so stick with me. I know there's a lot of charts, but we'll bring it all together at the end. So we also wanted to understand what respondents look for in COVID information, as understanding these values may help inform pandemic communication strategies in the future. We found that overall accuracy was the most important attribute, although this was significantly more so the case for white versus Black and Hispanic respondents. Alignment with political views was the least important. However, it was significantly more important for Black and Hispanics than white. Interestingly, we also found that Black and Hispanic respondents were significantly more likely to say it's important that COVID-19 information provide comfort and take away worries. So we also wanted to examine COVID-19, how COVID-19 information is impacting Black, Hispanic, and white adults. So overall, a large proportion of respondents said that this information made them feel stressed, worried, anxious, or depressed. However, our white respondents were significantly more likely to feel this way than Blacks and Hispanics. So generally, far fewer respondents felt that COVID information gave them a sense of empowerment, control, and peace. However, Black respondents were significantly more likely than our white adults to say that they felt a sense of peace from COVID information. And Black and Hispanic adults were significantly more likely to say that COVID information helped them feel present in their daily lives, which is interesting. You know, we were interested in exploring this because that sentiment is reflective of a state of mindfulness, something we know can be useful for helping combat anxiety and promote happiness. We also examined how informed people felt about COVID-19. Overall, white respondents were more likely to convey that they felt well informed. They were significantly more likely to say that they feel well informed about the current state of the pandemic, about government guidelines related to the pandemic, and about how to protect themselves. This is despite there being relatively similar levels of exposure to information about COVID prevention and disease incidence and death across races. So another question we examined is, you know, are there certain kinds of information that are associated with feeling that one has experienced positive things amidst COVID, essentially positively reframing the pandemic? So this graph shows the correlation coefficients for all information that had a significant correlation with positive reframing. For example, getting increased information about how the pandemic is impacting various populations and aspects of society, the green bars here, was associated with increased positive reframing of the pandemic. Also interesting, and as we might hope, the kind of information that is most strongly associated with feeling that one has experienced positive things during COVID is guidance on coping with stress and mental health. This finding underscores the importance of making information about mental health coping available to people during pandemics. We also drilled down to examine these associations across racial groups. To study the interaction between race, information exposure, and our outcomes, we combined all of those different kinds of information that I described, that we were evaluating. We combined all of those types of information into 4 categories using a factor analysis. And those 4 categories are the ones that I showed earlier in this talk. And for the sake of this talk, I'm going to focus on the first 2 categories. So this graph shows how getting increased information about available support and services amidst COVID is associated with experiences of positive things amidst COVID. You'll see that we have low, medium, and high, meaning that people, getting a little bit of information of this type, a medium amount or a high amount. This graph highlights variations in this association across racial groups. And so you'll see here that we have created a composite information score, again, that's characterizing this low, medium, and high amount of exposure. And you can see on the right-hand side, each of these information types that make up this composite information exposure measure. So one trend we see in this graph is that Black respondents are overall more likely to say they have experienced positive things amidst COVID. And essentially, this does not change as they move from getting low amounts of information about support and services to getting higher amounts. Amongst Hispanic respondents, in contrast, we see larger increases in their experiences of positive things as they report getting more information about available support and services during the pandemic. This graph shows similar patterns. Amongst Black respondents, we see very little change in their feeling that they've experienced positive things amidst COVID as they move from getting low to higher amounts of information about the impact of COVID on various populations. Amongst Hispanic respondents, in contrast, we see larger increases, again, as they move to getting more information of this kind. So if you recall, we also asked participants overall to what extent getting COVID-19 information made them feel positive and negative emotions. So the positive emotions were being present in one's life, feeling a sense of empowerment, a sense of control, and feeling at peace. And then the negative emotions were feeling stressed, worried, anxious, and depressed. So we wanted to explore if there was an association between the amount and types of information that people were exposed to and the way COVID-19 information made them feel. So going back to our correlation analyses, we saw that increases in exposure to almost every type of COVID information was associated with increases in positive emotions. And we thought it was important to really get quite specific here. There's been other work looking at COVID information exposure, but we really wanted to drill down and see if particular kinds of information have different kinds of impact. And so here, for sake of readability, I've only listed some of the information that was correlated with these positive emotions. But again, our findings showed that every kind of information that we evaluated was associated with positive outcomes like a sense of empowerment and peace. This was true for everything except information about the number of cases and deaths. And we see similar patterns here in terms of how the association plays out across racial and ethnic groups when we look at information that people have gained about support and services and how they feel, the positive emotions that they feel. So here we see that the trends when you look at white respondents, Black respondents, and Hispanics, the more information that they're getting about these support and services, the more they report feeling these positive emotions. Let's see. Okay. Oh, okay. So, and then we see the similar pattern when looking at exposure to information about the impact of COVID-19 on things like the economy and various population groups. Getting more of this information is associated with increased positive feelings. We also asked participants to what extent getting COVID information made them feel stressed, worried, anxious, or depressed. And we found that getting various pieces of information was associated with these negative feelings. In particular, sort of the opposite of what we saw with the positive emotions, getting information about the number of cases and deaths was most highly correlated with these negative feelings as compared to other types of information. But all of the types of information I've listed here are positively correlated with these feelings. So this is just a takeaway from this. So again, we drilled down to examine these associations across racial and ethnic groups. Across racial groups, we see that increases in exposure to information about the impact of COVID are associated with increased reporting that COVID-19 information has made them feel negative emotions such as stress and anxiety. Interestingly, we do see slightly different patterns across racial groups when looking at information gained about available services and support amidst COVID. So getting more information about support and services amidst COVID was associated with lower levels of stress, worry, and anxiety amongst white respondents. Amongst Black respondents, getting more information was not associated with the change in their feelings. And then amongst Hispanic respondents, getting more information about support and services was actually associated with more negative emotions. So I am going to be finishing early, so we have lots of time for questions, but some concluding thoughts to try to bring these different findings together. We definitely saw many differences in our white, Black, and Hispanic respondents and across socioeconomic status. We had a sample of adults from low and middle income households in Georgia and Massachusetts, and we saw these differences in terms of the information that people were exposed to, their attitudes towards it, their values around it, things like how important accuracy is, how important it is for that information to take away your worries. And then we also saw differences in terms of the impact of that information. Again, people talking about how that information made them feel, whether they were feeling positive or negative emotions. And these findings emphasize the importance of studying issues of race and socioeconomic status amidst public health crises such as COVID-19. There are several areas for future work that these findings point to. For example, many of our respondents reported feeling stressed by COVID information, and this was particularly true for white adults. And so, we also saw that getting more information about cases and deaths is especially associated with these negative emotions. And so, I think it's an important question to explore: how can we seek to mitigate these feelings? This information can be helpful for informing perceptions of risk, for encouraging individuals to take appropriate preventive measures to mitigate the spread of this disease. But how do we sort of mitigate against the potential unintended and negative emotional consequences of accessing this information? I think there's a lot of room for further work examining message framing, how to frame the messages in public health information communication amidst the pandemic, as well as thinking about mental health interventions that are specifically designed to help individuals process and cope with the information that they're receiving amidst the pandemic. One of the other projects in my lab that we have going on is examining COVID-19 information visualization, specifically the techniques that are being used in those, and eventually understanding the impact of different kinds of visualizations on individuals. And I think that's one important area of future work, to look not only at textual or verbal information, but also visual information that's being communicated, and the impacts of that information, not only on knowledge, but also, of course, attitudes around risk perceptions, and also the emotional and psychological impact of consuming visual information. We also interestingly saw that our Black and Hispanic respondents reported feeling more present, more at peace, and less stress as a result of looking at COVID information. And so understanding the mechanisms at play here will be important for shaping future information communication. Why do we see those higher levels of positive emotions in response to consuming COVID information? We also saw that amidst these populations, there was a higher value placed on information that provides comfort and takes away worries. And so that's a potential explanation, at least a hypothesis to explore, that perhaps because these respondents were valuing information that takes away their comfort and worries, that may have led them to seek out that information and thus receive more positive benefits, emotional benefits from the information they were consuming. We should further explore potential unintended consequences here. Placing increased value on information that takes away comfort and worries leads to selectively choosing information that is not providing a full sense of the actual risks that would be important to explore as well. And so, right, we need more work that examines how to strike the right balance here. And then finally, there's, I think, a lot of opportunity to try to understand the reasons behind these various associations that I've reported here today. For example, why is getting increased information, for example, about COVID-19 support, services, and impact, why is this associated with both increases in positive and negative emotions? And what are the implications of information potentially having this dual emotional impact? And then across racial and ethnic groups, why are different kinds of information associated with different emotional reactions to that information, and what implications does that have for the design and dissemination of pandemic information, as well as interventions that seek to support individuals amidst these pandemics. So next steps for our project, we have planned to qualitatively interview a subset of our survey sample. We'll be purposefully sampling there to identify participants who can help us explore some of these follow-up questions that I've mentioned. I also mentioned this is a longitudinal survey, so we have these 8 waves, and we have just begun the time series analyses to try to understand how patterns such as the ones I've described today are changing over time. How is information consumption changing over the course of a pandemic? How our attitudes towards this information changing? How's the impact of this information changing? And then we also plan and have started doing additional subgroup analyses to understand differences across a variety of demographic categories. So that is my overview of our project. I'd be happy to take any questions, and thank you for listening.
Thank you, Andrea. That was great. Just a reminder, folks, please feel free to enter your questions in the chat or the Q&A, and we will ask them. And so we do have a question already. It seems a bit like people's distress was dependent on their expectations. Might they suffer a loss versus could they stand to gain, for example, solid information assistance they hadn't expected? How to explore these distinctions?
Right. So and I can't see the questions, but so you said that it seems that, sorry, could you repeat the question? I was,
sure. Their distress was dependent on their expectations of whether they might be suffering, whether they think they're going to suffer a loss versus whether they're standing to gain something from looking at information. So how can we explore these distinctions of what their expectations are?
Yeah, I agree. I think that that's a very reasonable hypothesis. I think, I mean, you can certainly think about, for example, creating health communication apps that are, designed for, crises events, and having them be tailored and responsive and adapted to personality characteristics. And of course, as we know, there's been decades of work looking at message framing and public health, and so I think you certainly could do more analysis like we've done today to kind of tease apart different sort of personas in terms of what kinds of folks are likely to respond in what ways to what kinds of information, and use computational methods to create a tailored health communication sort of environment. So I think that's one way of thinking about it. I mean, I think it's also, that's why I'm very excited about the qualitative interviews, because I think it's more nuanced than I've presented here today in terms of the factors that are going into people's their attitudes towards what they're looking for in information, and then how it ends up impacting them. And so there's certainly, more variables at play than I covered today. And so I think any kind of future approach would need to take that into account as well.
Thank you. And we also have a question. Do you have thoughts on the role that of personality or pre-existing mental health concerns might have on the positive or negative emotions associated with consuming information?
Yeah, that's a great question. And we did not ask about in this survey pre-existing mental health conditions, but we're planning to do another round of this in 2021, with hopefully a larger sample, and that's something that I definitely would like to explore. And so we did assess, use the PHQ-4 to assess anxiety, like baseline anxiety level, and we've repeated that measure throughout the survey. And so we are doing some analyses there to look at, how just like general, anxiety levels are associated with different variables. So that would partially answer this, but looking at like a larger range beyond the anxiety and depression that we're measuring there, of mental health concerns, I think would be a valuable next step.
Thank you. So I had a couple of questions, Andrea, for your talk. One was, I was struck by the chart you showed at the end, the consistency between the low, medium, and high information used among Black participants, more so than amongst the white and the Hispanic, especially the Hispanic participants, where there seemed to be a greater distinction. Do you have any sense of why that's happening? Just, I know you didn't do the qualitative work to ask, but I'm just kind of curious whether that's something that struck your team also.
Yeah, let me pull that up. So kind of like this.
Yeah.
This chart. Yeah. So and this is showing that that even as you increase in your consumption of this information, and even as Black respondents are increasing in their consumption of this information, that their reporting of feeling stressed or anxious because of COVID information does not really change. So there is variability in like the amount of information, but the association with this, this negative outcomes is less. But you might also be pointing to, are you also pointing to the bars, and that there's more variation there as well? Okay.
Between the Hispanic population, especially the Hispanic population.
Yeah.
And the Black participants.
Yeah. So we were talking about this a couple of days ago, and we need to go back and look at the makeup of our Hispanic sample, and see if there's anything there that might explain this, like a greater variability in income levels or age, or something that maybe is causing more variability there. So we did notice that, and it's not clear both why there's more variation within that category in terms of the information that they're getting, the correlation, and then also looking at the Black respondents, why there seems to be such consistency there. I don't have an answer, but yes, hopefully further analysis of our existing data and then complementing it with the qualitative will help.
So we have a question in our chat that first saying, great talk, so interesting with much enthusiasm and highly relevant. So excited to read about this later on and see what the qualitative work says, especially, and hopeful I didn't miss this, but I wonder how much medical distrust and concerns for ethical treatment is associated with individuals' emotional reactions to COVID-19 information that they're finding or seeking. For example, I imagine people of color and those from other minority populations are thinking things like, COVID-19 is affecting my people so much. Even if I get it, I might not make it out because I'm Black or Latino X. Among other things, I'm interested to see what the qualitative work would say.
Absolutely. Can I tell you, we had a medical mistrust measure in the survey that I was fighting strongly for, and then it was just so long that we ended up taking it out. So I completely agree, and I think that's an important aspect of this to explore, that we definitely hopefully will explore in the interviews, in hopefully in the second round of this that we do in 2021. So I think absolutely, I mean, this is also something that we've wanted to explore in the interviews, is the recognition that I think the term is like a syndemic, that the fact that there's these multiple pandemics happening at once, the COVID-19, of course, the racial injustice that has always been there, but is just being discussed more and more generally visible. And so trying to understand the intersection of these huge societal circumstances and how they're all combining together. I think that, again, that's why I was saying this sort of like, there's much more nuance to what's going on here than even what I am able to report from our findings. But I absolutely think that, sure, people's trust in this information is going. I would be very surprised if levels of trust were not, in this kind of information, were not very highly associated with medical mistrust or trust. Yeah. So much to say, but yes, basically I agree with you. We should be exploring those topics in concert.
Thank you. Great. I had another question, and this was dealing with the waves, and so I was just curious. I know you said you started to look at the time lapse. Have you looked at any of that data? Or is this what you're seeing, this first wave being borne out? Is there, or anything you could basically say right now about the waves? Because I think it's great that you're doing this in waves, because this kind of understanding how people's views change and their understanding change. So just kind of curious if you give us any teasers about what you're finding.
Yes. So, and it's funny because I was going to put some of that in here, and then I was getting too long, and then I overcompensated and taking that out. But so some of the things, I'm trying to think back now. We're seeing surprising consistency in various trends. Let me just end this. And see if I can bring this up quickly. Okay, I may not be able to quickly find this. I don't want to misspeak, but I do, like, certainly attitudes towards, like values around COVID information, like, saying that accuracy is important, being able to take away my fears or worries, all of those kinds of questions, that was very stable, if I recall correctly, over the multiple months, that those values did not change. And I think that we did see there were some categories that I can't quite remember, where we did see like different trends, like, increases in, God, I can't remember if it was different kinds of information exposure, or in feeling, in how the information was making people feel. But we did basically we saw some trends where things were staying consistent and others where they weren't, which is not helpful at all. But perhaps as if we, yeah, I might be able to pull up those slides and give you some more interesting.
That's I mean, I'm just curious. I think I will wait for that. I'm sure there's going to be a great paper coming out of this.
Yeah.
That'll be coming. So I think that's all the questions I have seen. And this is a great talk. So first, thank you again, Andrea, for coming and talking to us. I think that, I mean, this is very interesting. The pandemic has changed a lot of things that we know. And I think and what you're starting to find in terms of how people look at information was interesting. One question I do actually want to wrap up with, because this was something that really was, I was reading about it. I think you answered a little bit, but I'll ask, this idea of misinformation and kind of the accuracy and the importance of accuracy. What is your sense of how these different groups kind of tend to, it seems like they all view accuracy as important.
Right.
How do they react? Is that one of the questions, I guess, as you do your qualitative interviews? Are you interested in understanding kind of how they react to this misinformation?
Yeah, because I think so. We both asked, how important is accuracy to you? So we asked that. We also asked, to what extent they believed various conspiracy theories. And we also asked how well they thought they were able to determine the accuracy of COVID information. And so one of the things that we haven't done yet is looking at like relationships between those three things, which I think, which of course are related, but getting at different aspects of misinformation. And so I think that will be interesting to like form a richer picture of what's happening there, both like what they value, what kind of information that is clearly untrue or arguably untrue they're getting exposed to, and then how well they think that they are equipped, because just equipped to sort of sift through that information, because just because accuracy is a value doesn't mean people feel able to assess that. So analyzing the three of those questions in concert, I think will be interesting. I did pull up, if you're interested, some of the time series analysis, and I can just like quickly say. So first of all, I reported on 498 participants from wave 1. Over the course of the waves, of course, we've had drop off. And so in the 7th wave, we had a little over 200 respondents and very few, even fewer Hispanic respondents. So in the time series analyses, we are just comparing white and Black because we had the large enough numbers for that. So, things like, how empowerment, I talked about, asking, to what extent does getting COVID information in the past 7 days make you feel empowered? And we see that for both Black and white respondents, we see a decrease in the feeling of empowerment, but that is much more pronounced and consistent across the waves, a consistent decrease amongst white respondents. And we see similar sorts of patterns with how well getting that information makes you feel a sense of control over your life. It's a sort of, it's not a straight line for our Black respondents. It sort of jumps up and down, but it's kind of a gradual and consistent decrease in feeling a sense of control for our white respondents. So those are like a couple of, there's lots of other graphs and some where we see, the trends mirroring each other across these two groups, and others where we see differing trends.
Great, thank you. Thank you, Kat. Thank you for your time, and thank you for everyone attending. I wanted to end with wishing everyone a happy holiday season and a safe holiday season as we close out this year. We will be restarting our seminar on January 5th, and our speaker will be Jakob Bardrum from Danish Technical University, and Jakob is one of the senior HCI leaders advising us working in mental health and HCI space. So thank you again, Andrea, and I hope everyone has a healthy and happy break in the next couple of weeks as we come to Christmas. Thank you.
Thank you so much.